In the last decade, the HSE invested only $428,000 in upgrades to the Owenacurra Centre in Middleton. Owenacurra was accommodating 20 residents up until 2021 in a community-based town centre location. It was considered an excellent service. I talked to the residents myself. They were exceptionally happy there, and many have been living there for over a decade. By contrast, the HSE invested far more money in institutional dorm-style out-of-town wards in the same 10-year period, which I've also visited in the last year. For instance, you spent $1.9 million on St Catherine's Ward and $2.9 million on wards and a day centre in St Stephen's Hospital. We also learned recently through FOI records released to myself almost a year late that 8 mental health facilities in CHO4 discussed by management out of the 8 health facilities discussed by management in 2019, the Owenacurra Centre was the only one mentioned as possible for sale. And I might add that, having talked about this issue a number of times at committees, that's directly in contrast to what we were told at committee, that it had never been discussed that site might be for sale. The FOI records indicate that the HSE advised limiting capital expenditure on the excellent service at Owenacurra. The replacement of premises such as Mount Alvernia in Mallow and Unit 1 in St Stephen's at a cost of millions was mentioned, but there was never one in any of the FOIs, in any of the PQs, not one mention of replacing Owenacurra or replacing that service or making it so that that service could continue. All of this suggests that there was an agenda for a significant amount of time of the last decade to close Owenacurra long before the closure was actually announced last year. And might I add, when it was announced, many of those residents were given around 3 months to get out of their home of over a decade. It's not about, we're way past the building. We're way past a discussion around the quality of the building in Owenacurra and whether it was in good nick or not. It's perfectly clear from the FOIs that I've received that the CHO in Cork, there was a tacit agreement by the management there and by estates that they were going to run that service into the ground and sell off the site. That is the reality of the decision making. So you were going to move residents to substandard premises, to shared accommodation, to shared rooms in places very far away from Middleton, very far away from their families, very far away from even a local shop or a community group. They were going to be cut off from their communities and put into shared rooms. And so I want to ask the senior management of the HSE, and I know, Mr. Reid, you're moving on soon, and I particularly like actually to hear, because this is estates, this is capital funding. I'd like to hear from the CFO and the COO. Do you stand by that decision making?
If I can come in first, Deputy, I said earlier on, I stand over the decision in relation to Owenacurra. The CHO can comment on other buildings in particular.
To be honest with you, I don't want to hear from the CHO. I want to hear from senior management. Do you stand by the setting aside of clinical advice and the running into the ground of a building that could have been held onto?
I stand over the decision in relation to Owenacurra. And I have to say, there were originally 21 residents, if I'm correct. Michael has confirmed this morning it's now down to 8. We are not giving people a time-limited period to get out. We've worked with all of the families.
Sorry, Mr. Reid, just to be clear, and I don't want to cut across you, but the reason that you're not giving people a time limit is because of the very hard work of some local representatives and the families. You did give them a time limit originally, which was 3 months.
Okay. We are working with the families very thoroughly to find suitable, available accommodation that meets the needs, and there are different needs for each of the residents. We've done that over the past number of months. It is down to 8 residents now that we're still working with. Substantively, their question, I do stand over the decision in relation to Owenacurra.
Okay, so that decision sets aside all best practice in terms of our national policies and clinical advice.